Hi, Dr. Blake. My name is Brianne Horlock, and this is my case study number 1. Here's a 360 of the room. I'm first going to start by sanitizing my hands. Wiping my stethoscope. Wiping my pen light. And donning gloves. Hi, my name is Brianne, and I'm going to examine you as to why you're having itchy and watery eyes, as well as headache and a rash. Is that okay?
Yes.
Before we start, do you have to empty your bladder?
No.
I'm now going to provide the patient with some privacy. I'm going to ask you some subjective questions. Is that okay?
Yes.
How long have you been experiencing these symptoms?
A week.
And how long do they normally last at a time?
An hour.
What is your pain on a scale of 1 to 10?
7.
Do you have any previous eye injuries?
No.
Any previous skin conditions such as hives or eczema?
No.
Patient is around 18 years old. Skin color is white, and there are no noticeable odors. Patient is nourished. Patient's body structures are symmetrical. Patient remains in good posture, and there are no physical deformities. Patient is happy and in a good mood. Speech is normal. Personal hygiene is good, and patient maintains eye contact. I'm now going to test the patient's gait. Could you stand up and walk towards me, please? Turn around, walk back, and sit down. Patient's gait is normal. Coordinates, balance, and strides are all normal and even. Patient's breathing is normal and consistent. There are no signs of distress. I'm now going to test the patient's alertness. What is your name?
Dario.
Do you know where you are?
I'm at the hospital.
Do you know what day of the week it is?
Monday.
Patient is alert and oriented. I'm now going to inspect and palpate the patient's skull. Any pain?
No.
Patient's skull is normal symphatic shape. There are no lesions, no swelling. Patient is not in any pain. There is no tenderness. I'm now going to inspect the patient's hair. Patient's hair is thick, wavy, and black. There are no foreign bodies or infestations. I'm now going to inspect and palpate the patient's facial structures. Any pain?
No.
Patient's facial structures are asymmetrical due to a rash under his left eye and neck region. Rash is red. Skin is dry and there are cracks in the skin. Patient has scars. Patient does not have scars. There are no lesions. And patient does have facial acne. I'm now going to test cranial nerve number 7, which is the facial nerve. Smile, with teeth, frown, raise eyebrows, close eyes tightly, puff cheeks. Patient's facial structures are symmetrical, so there is no damage to cranial nerve number 7, which is the facial nerve. I'm now going to inspect patient's eyes. Close, open. Patient's eyelashes and eyelids are normal. Skin is intact, no lid lag, no ptosis, minor periorbital edema. There is watery discharge, no lesions, and patient has even lash distribution. Patient's eyebrows are black, they are bilateral, they are symmetrical when patient's facial expressions move. There is no scaling or any lesions. Patient's eyeballs are moist and glossy. Conjunctiva is clear. There is a pink color on lower eyelid, and sclera is white. I'm now going to test the patient's eyes using Perla. Patient's pupils are 4 millimeters. They are symmetrical and round. I'm now going to perform the direct consensual light reflex exam. Patient's pupils constrict, so there are no problems with the direct consensual light reflex. I'm now going to perform the visual reflex accommodation exam. Look at my pen light. Papillary constrict and convergence is normal. So patient's pupils are equal, reactive and responsive to light and accommodations, which indicates that cranial nerve number 3, which is the oculomotor nerve, is intact. I'm now going to palpate the patient's lymph nodes. Preocular, posterior ocular, occipital, submental, submandibular, jugulodigastric, superficial cervical, deep cervical chain, posterior cervical, and supraclavicular. Any pain anywhere?
No.
Patient is in no pain, there's no tenderness or swelling, and there are also no lumps. This is my case study number 1. Here is a 360 of the room.